come in?
Hi. Good afternoon. How are you?
I'm doing fine. How you doing?
I'm good. Do you mind if I close this door to give you some privacy?
That's fine.
Okay. All right. Can I start off with your name and date of birth, please?
Yes. Anthony Robinson, 11/2/1969.
All right. It is approximately 5:30, May 9th, 2020. Are you feeling okay today, Mr. Robinson?
Yes, I'm feeling fine.
Okay. I'm going to be your nurse today, and I'm going to give you an assessment. We're going to be checking your neck for your carotid pulse. We're also going to do your abdomen, and we're going to check your cardiovascular. Do you have any questions before we begin?
No.
Okay. All right, so I'm going to go, and I'm going to clean my hands before we start. All right, and to begin, we're going to check for your carotid artery. Carotid artery is going to be located right here between your trachea and your sternocleidomastoid. Okay, I'm going to check your carotid pulse, and we're going to do this in 3 different places on your neck. And when I do this, I want you to inhale, exhale, and hold your breath, okay?
Okay.
All right, so I'm going to begin. Go ahead, inhale, exhale, and hold your breath for me. All right, I'm going to start right here at the angle of the jaw and the neck. I'm going to move down to the middle of the neck, and then we're going to move down to the base of the neck. Go ahead and exhale and breathe for me. Okay, now if you would do me a favor, would you go ahead and lean back on the bed?
Yes, no problem.
Okay, now we're going to check for your JVD, and in this, normally the patient is going to be at a 35 to 45 degree angle on the bed, and there would normally not be a pillow located behind them. So what I'm going to do is I'm going to get out my ruler. I'm going to use the centimeter side of the ruler. Could you please turn your neck for me? And the ruler would be placed here, right in the middle of the chest. And we're going to check for the vein here and see the engorgement of the blood flow. When we get that height, we're going to measure it with a straight edge, straight to the ruler, and it is at about a 6. Okay. All right, so after I do that, what I'm going to do is I'm going to look at your chest area, and I'm going to inspect everything on your chest. I'm going to look and check to make sure there's no wounds, sores, or lesions, which everything appears to be fine. I'm going to check the color of your skin, which goes with your ethnicity. The patient here is a brown skin African American, so everything is correct as far as his skin tone. We're also going to check for lifts and heaves in your chest, which there shouldn't be any. Okay. What I'm going to do now is check for your apical pulse, which is going to be found here from your 5th intercostal space and your mid-clavicular line. We're going to come all the way down and meet it right here up underneath the breast tissue, and we're going to check for the pulse there. Okay. And everything there seems to feel fine. We're also going to check for thrills. For that, I'm going to check in 3 different areas. I'm going to place my hand flat here in your mid-sternal border. I'm just going to place my hand here on your chest, right over your heart. And then I'm going to come back down to where your apical pulse is located, and I'm going to place my hand here as well. And you feel fine? Everything's okay?
Yes, ma'am.
Okay. All right. So the next thing I'm going to do is some auscultation. What I'm going to do is listen for the sounds. I'm going to use my diaphragm. And I'm going to come right over here. We're going to listen to the aortic valve first. Then listen for your S1, S2. And it should just be a lub-dub sound. Okay, that sounds good. We're going to go to the second intercostal space. We're going to go across your sternum. And we're going to listen to your pulmonic valve. That sounds good. We're going to go down here to your third intercostal space. This location is called Erb's Point. Listen to the same lub-dub sound. We're going to be here at your fifth intercostal space and listen to the tricuspid. Sounds good. And then we're going to go right down here, axillary, and listen to your mitral valve. And that sounds good as well. Okay, so your S1 and S2 heart sounds were heard, and they all sound normal. Your heart rate is about 68 beats per minute. So everything there sounds good. Next thing we're going to do is we're going to be checking in your abdomen. And in your abdomen, the first thing I'm going to start off is by checking the angle and the symmetry of it. And everything looks symmetrical on the abdomen. Your contour is flat, so that looks good. After this, what I'm gonna do is I'm gonna listen for some vowel sounds, and we're gonna be listening to the vowel sounds in several different areas. We're gonna listen to all 4 quadrants in your stomach. So we're gonna start with the right lower quadrant. We're gonna move up to the right upper quadrant. We're gonna move over here to the left upper quadrant. And then we're gonna move back down to the left lower quadrant. And your vowel sounds appear to be normal active vowel sounds. What I'm going to do right now is I'm going to use the bell of my stethoscope, and I'm going to listen for your aorta sound right around the costal angle. I'm going to move down a little bit laterally and listen to your renal sounds. I'm going to move here from the left side to the right side. Okay. What I'm going to do then is listen from your right to your left here at your iliac crest. Okay. All right, that all sounds good. And normally what we would do next is move down to the lower area of the patient, and we would listen for their female artery, which we're not going to do in this video, but that would be the next step that we would do. After that, I am going to begin to percuss, and I'm going to do that in all 4 of your quadrants as well. What I'm going to be doing there is listening for any tympanic sounds. So let's start with your right lower quadrant. And we're going to do all 4 quadrants from the right lower to the right upper to the left upper, and then we're going to go down to the left lower. Okay. Was there any pain or anything that you felt with any of that?
No, ma'am.
Okay. After that, the next step that I'm going to do is I'm going to palpate. I'm going to first start by lightly palpating, and then I'm going to deeply palpate. We're going to do that as well in all 4 quadrants of your stomach. And in this, I just want you to like normally breathe. So just normal inhale and exhale, okay?
Okay.
I'm just going to use my 2 fingers. We're going to move from side to side. Feeling in all quadrants. Okay, so after my light palpation, I'm going to deeply palpate. Is there any pain or anything?
No.
Okay, so in your right lower quadrant, normally in this area you would have your appendix and the cecum part of your colon. As we move up to your right upper quadrant is where you would find your ascending colon, as well as your liver, your gallbladder, and part of your transverse colon. To the left upper quadrant is another part of the transverse colon, and then you'll also have your descending colon here as well, and your stomach and your spleen. As we move down to your left lower quadrant, what we would find here would be your sigmoid colon. And you said there's no pain or anything felt when I did that in those areas?
No, ma'am.
Okay. All right, so one other thing that I wanted to do before we move down to the lower part of your body is I'm going to take my hand and I'm going to place it under your back, and then I'm going to use my next hand and come right up here underneath your rib cage, and I just want you to breathe in and breathe out for me. Inhale and exhale. Okay, I'm going to do the same thing on this side. Place my arm here, and then we're going to come down here, axillary, and I want you to do the same thing for me. I want you to inhale and exhale. Okay, good. All right, so after this, what I'm going to do is I'm going to go down to the lower part of your body, and we're going to check down in your leg area, okay?
Okay.
All right, so first, your skin is dry. There's no wounds, lesions, or anything down here, so everything looks good. Right here is where we would find your pulse. And we're going to check the pulse here. 1 second. Okay. So this is where your tibial pulse will be, right here behind your ankle. Sorry about that. We're going to check here from where your big toe is. Come down here. Find your dorsal PDS pulse. Good. What I'm also going to do is check the temperature of your skin. Temperature is appropriate. You don't feel too cold, too hot. I'm going to check for pitting and see if there's any edemas. Which I do not find. Okay, good. All right, now there's one more thing that we need to check. I'm gonna go ahead and re-sanitize my hands. And what you do is go ahead and sit up for me.
Okay.
All right, and if you would please turn to the side a little bit for me.
This way?
Yes.
Okay.
And while you're doing that, I am going to, sorry, stethoscope. I'm going to check your CVA. So if you would turn a little bit more for me, please. And just check here. Make sure that there's no urinary backup. What I'm going to do is have my hands placed right here above where your waist would be located. And just breathe normally for me. Okay. Now, is there any pain, tenderness, or tightness or anything in any areas in your back?
No.
All right, well, Mr. Robinson, everything seems to check out okay. I don't have any abnormal findings or anything for you. Is there any questions or anything that you had?
No, ma'am.
No, you're feeling good?
Yes.
Okay. All right, well, I'm just gonna go ahead and clean my hands one more time before exiting. And if you don't have any questions or any concerns or anything, you are free to go.
All right. Thank you, ma'am.
No problem. Thank you. You enjoy the rest of your day.
All right, you too.